We're going to shift gears a bit now for our next session, which is on precision public health. Today's health and human services leaders are faced with national opioid epidemics, federal budget and legal uncertainties, and increasingly unhealthy healthcare super users. These and other forces make for a more complex, multi-crises environment. This session will focus on what precision health means, where it is successfully being used, and how this modern big data platform can be adopted to enhance health and human services. Our speakers for this session are Sean Dawley, Cloudera's Health and Life Science Big Data Expert, and Larkin Kay, Cloudera's Business Value Consultant. Please join me in welcoming Sean and Larkin to the stage.
Good morning. Thank you for coming. Isn't this an amazing place? I want to thank, I also heard it was going to snow today. So you're the hardy souls who came out in the snow. I appreciate that. We appreciate that. I want to thank the organizers. If you guys and gals, as you're leaving or in a break, get a chance to say hi to Kate Tong and Lisa Sion and the folks from Government Forum, I think it's called, super people. So today, you get a tandem, you get a combination of presentation, which is, who's here that lives in the Denver metro area? Raise your hand. Oh my gosh. Lots. I want to introduce you to one of your neighbors, who is my colleague. Where's Larkin? Hey, there's Larkin. Come over here. So Larkin is this amazing business person. Walk forward so they can see her here. So she lives in Denver, which, since I live in DC, I can tell you is very appealing with snow and mountains and all these things.
Best place.
So I have 17 minutes. Larkin has 8 minutes. And you're going to keep me on track, hopefully.
Yeah.
Okay.
No problem.
Okay. So I'm the industry leader globally for health and life science at Cloudera. I want to let you know that the subtitle, this presentation has a subtitle, which you need to remember for later in the presentation. This is the subtitle. A Canadian, a Brit, Barack Obama, an Australian, a CEO, and you walk into a bar. Okay, that's the subtitle. Don't forget that. Okay, so I think now I probably only have 15 minutes, so I'm going to go fast. One of the things that's amazing about Cloudera is that we've grown in size enough that when I do customer user group calls for our healthcare group, it's an amazing mix of people. We'll do a call and we'll have Glaxo and Novartis and Astellas and AbbVie, and we'll have 4 of the top 6 pharmas on the phone sharing ideas. And we'll have competing health systems in the same region sharing ideas. And a lot of times, one of the most fun things about what I do is when I walk into a hospital and they say, hey, we want to get on the phone with Children's Healthcare of Atlanta for streaming data because we want to do that and we want to know what their use cases are. So most of the large healthcare organizations in any particular space, med device, genomics, pick one, is a customer of ours. So one of the slides that I like also touches on Mars. And there's two, I was thinking as I was making the slides for this presentation, where I want to talk about public health and I want to talk about this very new thing that is only probably 2 years old called precision public health, was what is the most precision we have? And I will tell you that NASA has selected Cloudera as their data lake to support the research for going to Mars. And I will tell you right now, if you had the time, because I did this, to go on NASA and the grant-making organizations, you can find lots of very obscure grants where they will give you money to medically research very weird health things that you don't even want to read half of them. But there are doctors all around the world who are going to study weird stuff about your body when it goes to Mars. The amount of clinical help an astronaut who goes to Mars will get is beyond comprehension. Teams of doctors. You know who else get teams of doctors for one person? This person. Millions and millions, and I'm not talking about millions and millions to train a group of people. I'm talking about millions and millions to train that one individual. And I will tell you that Cloudera is involved with the fact that if you were to go through that pack and look through that pack, tomorrow, what's impossible today but possible tomorrow because of Cloudera is there's not a first aid kit in that pack. There is a mobile hospital and telehealth connection system in that pack that enables 10 physicians at varying stages geographically, all the way back to the US, for that resource, that very expensive resource. I don't get that in my life. That's not my healthcare plan. I don't think anyone gets that. So that's the left side of the screen. We're giving 10 doctors for those folks. On the right side of the screen is whether you're someone who works for the state of Colorado, the city of Denver, wherever you're from. I know we have someone who works in the health realm of the state here. What I learned this morning about the Denver airport, which to me was amazing about the Denver airport when I came in yesterday, is it took me about 4 minutes when I walked off my plane to get a taxi. It had a very small airport feel. It was amazing. And then I learned this morning, it's ginormous. And it's a city. It's a city. So whether I'm working at a city or the airport city, I might have what's on the right. 2 weeks ago, I was on a panel. This is one of the great things, too. They've decided they needed a warm-up act for the panel I was on with 2 physicians. So they brought in the governor of Virginia. I'm kidding, that was a joke. He was the featured speaker, but we were there. And he was talking about running healthcare in the state. And the guy next to me, who was a doctor, said, next week I'm going to Rwanda. He was a cardiologist. He runs a research institute. And someone in the audience was talking about, why are you going to Rwanda? And he said, in Rwanda, and I don't know how many people are in Rwanda. You can look it up on your phone. He said they had 4 cardiologists for the entire country of Rwanda. And one of the cardiologists retired. That's why he was going to Rwanda. What reality is that usually we don't have health care. Whatever the ratio is, it's too small. And we don't have the money to actually do clinical care in any kind of effective way. Okay, remember the subtitle. You got it in your mind? Okay, here we go, chronologically. Now, see that little ninja, that little gender-neutral martial arts superhero? Don't ignore that little person. Okay, so in the black and white is what I would call the father of precision public health, a guy named Mark Lalonde, not a physician. He was in Canada. He worked for the current prime minister's probably father. And he said, right now, what we do in public health treats no one. We're so limited. What we need to do is find the people that are at high risk and just treat them. So we're going to find the super users and we're going to find the folks at high risk. He's the father of precision public health. Along 10 years later in the 80s comes a Brit. He says, look, I get it. We want to treat the people that are of the highest risk, but we can't ignore everyone. And that's what led us to have such good progress with smoking today, is we said with smoking, we're going to take it out of all the we're going to treat this across the whole population. We're going to treat it at the root cause. We're not just going to get the people that have lung cancer. We're going to get everyone. So that's important too. But there's a set of folks out there who say, well, we don't like finding subgroups in a large population that we can really lavish some help on. Maybe we should only do it for everyone. Here comes Barack Obama, precision in everything he does. The Precision Medicine Initiative in the US where we're collecting genomes. Let's do drones. Let's do special forces like the person that I showed on the mountain before. And in the construct of the fact that we are embracing precision in lots of different parts of our lives, and Amy, who's my boss, talked about that earlier. They got my order messed up. Okay, well imagine this guy. This guy's supposed to be here. Okay, they would have to walk in the bar in a specific order. I'm just kidding, they don't. Okay, so this guy on the left, Tarun Weeramanthri, is a native Australian. He is on the western part of Australia, and he coined a term called precision public health. And 2 people said, this is exactly what we do. One is the CEO of the Bill and Melinda Gates Foundation, Sue Desmond-Hellmann, who you see in the upper left, and the other is Moeen Khoury at the CDC. What they said was, if today we have so little public funds and we need to be the most helpful that we can be, and we're committed to helping everyone, so we're not going to not do that, what we need to do is we need to not increase funding for healthcare. We need to use data, big data, and technology, and advancements in big data and technology, and apply those to all those people, all those Rwandans, all those people at the airport, all those whoever, and we're going to call that precision public health, and it requires big data. And so the last part of that subtitle for this presentation is, and you. And what I found is, and I'll show you a list of use cases, everyone I talk to, even outside of health, says, I want to find a homogeneous subgroup within my larger population. And oh, by the way, everyone who's been doing that has been using big data to do it. And I want to apply some intervention to them in a specific way. And sometimes they use the big data to apply the intervention, not only to find them. And then the next phase of that is I want to predict where they're going to pop up, where they're going to go, who they are before they're there, so I can anticipate. That's it. That's precision public health, but it's also just precision. Okay, use cases, super fast. These are all use cases that have specific examples in peer-reviewed academic journals for precision public health and the use of big data. Because I'm writing a journal article on it, and you probably can't read it, but my two favorite are child abuse and opioid abuse. Christine talked about opioids earlier. This is my favorite one. I don't have a really good case study. I'm going to talk about Cleveland in a second. I think there's multiple uses starting up of big data in this, and my hope is for anyone here, if the opioid epidemic is touching you, we would love to partner with you to figure out how we can solve that and slow it down and ultimately solve that in our communities. I also mentioned child abuse because I am on the board of a group called Predict, Align, Prevent with a colleague of mine, Dr. Diane Daly, who did a type of precision public health with mapping, and there's a mapping expert here somewhere from the Geologic Survey. I was talking this morning, was an interesting person. And Emily Putnam-Horstein in Los Angeles does this, and there's a few people around the country who can actually predict in a city next year very small locations of where child abuse will occur. And so the question very quickly comes, if I have big data and if I have this kind of technology, how can I apply interventions in these very select areas, which is a kind of precision public health, to create protective factors for kids? So 2 slides left, really one. This is the success case. Case Western University and the city of Cleveland have basically said, look, we can get all the hospitals to put the data in a data lake. If all the fancy talk this morning was confusing, Cloudera creates data lakes. If you want to create a data lake, you need to put it in Cloudera if you want to be successful, in my humble opinion. So they said, we're going to get the hospitals, and we're going to get that data, and we're going to get the public data, and we're going to put it in a big data lake, and then we're going to let epidemiologists solve problems for the city of Cleveland. And you can, I'm sure you'll be able to get these slides, but they're going to have 3 million patient records. Now, here's what's interesting. What I think is super interesting is I bet you didn't know that there are almost 1,000 researchers around the world, and they use the same data model for researching healthcare, and it's free, and it's open source. In fact, I think the University of Colorado has a principal investigator. In fact, I'm sure they are. It's under the rubric of an organization called Odyssey. The data model itself is called OMOP. It's free and open source. And guess what? There's a working group within Odyssey called the Hadoop Working Group, which I moderated for a year with all kinds of super people that you'd love. And even if you don't use Cloudera, you still should use this open model, because then you could federate your queries out all over the world to people who have data, and they will run your query for you and not move their data. And some of them will ask you, hey, I'm doing a study on people that have cardiac arrest. How about you guys at the airport run this on your little data set? If it's in the OMOP model, you can do it. So I'm super keen on any kind of open source collaboration that we can do across the US. Okay, that's it. I'll say one thing. I work with MDs and PhDs, researchers, folks that are focused on health. We are focused on usually one pathology, one study, one mission, one epidemic, one pandemic. And in that, what I've learned is, I don't really care about what the technology is. They don't care what the technology is. They want good technology. We give them good technology. They win. So what I say is, pick a use case. Just pick one use case. I am the eat for a day guy. I am going to solve your mission, which is sometimes interesting when I'm with Cloudera. I was at the Pentagon. I was with a Cloudera person, and the person was talking about MRIs. He said, Sean, we don't know how many MRIs we have in the military. Does that seem odd to you? And when someone asks us, can we buy a new MRI, the question comes to me, and I don't know the answer if they can buy one. And I said, great, we are going to do a project, and we are going to build a data lake, and we are going to solve that problem, and that's going to save you what? He said, well, it'll save us at least $2.5 million a year. And the Cloudera person next to me said, no. I said, yeah, we're gonna do a study. This is just for one study. That's it. Then we're done. But we create information portals that help people across many, many questions. So what I learned about Cloudera is there's a second part of Cloudera. It's not just solving opioids in one city or state or county. It's actually a business practice. And that's why I said to Larkin, hey, can you come talk a little bit about what it means as a public servant, not only to solve one use case, but to create a future of use cases. So, here, do you want this?
I have
You
a
have
mic
one?
someplace,
Okay, use yours.
So thank you, Sean. You actually left me 10 minutes, or 9 maybe, so you did great. Do you have a clicker? No problem. So thank you all for making Denver a better place to live. I really enjoy it. I say my husband makes precision transportation for me. He works at RTD. Are any of you from RTD here? Anyways, I live in Stapleton, and he made the train stop in Stapleton and bring me to the airport, because my job is to go to companies and organizations and talk to them about what we learn from our other customers about how to become data-driven. So yes, solve that first use case, but really join the data-driven journey. And what we mean by that, our founder, Amr, has been quoted in the media saying becoming data-driven is really like a 30 or 40-year journey. And I don't know about you, but I'm going to be really tired of traveling in 30 or 40 years, so I hope it's not quite that long. But what we mean by that is if you look at the adoption of the internet, when the internet first came out, we used it for one-to-one communications, replacing fax machines and that kind of thing. And as we've moved along to current day, now the titans in almost every industry sector is purely internet players. So, we took Uber here. They don't own the cars. They are an internet company. So it went from, being simple chat and email to becoming whole businesses. And we believe that data has that same promise over the course of the next couple decades. So we always say to our customers, think big. Think how data will transform your industry, your sector, but start small. Start with that single use case. And then iterate often. Every use case can be iterated. You can add different parts of a data set, different columns of that data set, different data sets to a use case to transform it completely. You can layer on different analytical methods. You can serve out data in different ways to really transform the use of the data. So this is the number one piece of advice we're brought in to tell companies is really, yes, you got to think small, or you have to start small, but it's like a toddler walking. That first use case might take a lot of falls. The second use case takes a lot less. And hopefully by the end of your first year, you're kind of on your way to really running. Amy hit on these earlier. To be quite frank, this is one slide and a 200-slide deck that Amy and I deliver based on our experience. We worked at Nokia together very early on, about 6 or 7 years ago. We were one of Cloudera's first big customers, and we took a big data practice from really being nothing, distributed kind of clusters of Cloudera that were downloaded for free, into a centralized data resource that was accessed by 800 users, had over 1 petabyte of data, which doesn't sound like a whole lot now, but 6 years ago, that was a lot, and had over 10,000 jobs running daily on the shared data source. We did that in about 18 months, from nothing to that scale. So these were some of the things we learned there, and as we've gone around and talked to companies and agencies, we've really verified. And I'll tell you that no matter how small you're starting as one person in an agency that's looking at Cloudera or looking at Hadoop and one single project, to you're a huge corporation and have a big data group of hundreds. These same principles apply, and I just want to take a second to talk about maybe how they would apply to you. So first, build a data-driven culture. There's really 2 key aspects of that. When you start a project, you really want a sponsor for that project, someone that's going to evangelize why you're doing it, why you need the resources, what the learnings are. To really make a decision data-driven, you have to get the information out there. And the second part of the data-driven culture is communication. And why communication is so important is because a lot of these analytic processes take small teams. We think about Scrum teams because we really talk about Agile. It takes 2, 3 people with some varying skill sets to partner and drive to a use case. So creating communication methods, we see big data days, kind of networking events like this, meetups where practitioners come together and really drive the agenda themselves about what data sources they're pulling in, who can access that data, the data scientists coming in talking about the different use cases and applications they're putting together with the data. And then also, one of the more successful and recent kind of communication methodologies we see in the big data world are hackathons. And Sean, didn't you just participate in a hackathon about Zika virus? So that's where you pull together resources from universities, from Cloudera, from our partners, to quickly bring together data and analyze it. You have to build a data-driven culture in your own small group, whether it's an IT group or your business leadership team. But you also have to go proliferate why data and why making informed decisions will change your industry and have that vision. Second is developing the right teams and skills. And if you're sitting there as one person in a group, you might say, what does this have to do with me? I don't have a budget to build out a big team. But you definitely need 3 distinct skill sets if you're going to tackle any kind of real big data problem. One is data engineering, and this is something that's new to this world, but it's really bringing in data sets at full fidelity, cleansing them, archiving them, and making them available. So adding simple schemas and search indexes to them. Because if you're going to build out for the long term a big data lake, you don't want it to be a lake that's stagnant. You want it to have ripples and be able to be accessed by boats and users and whatever it is. So you need to have ways to make that data that's sitting in the lake more accessible. The second skill set is data science, or those people that can make applications out of all that raw resource. And that we find being several different skill sets depending on what you're really trying to accomplish. One is that hacker skills. Second is the true analytical models, that deep knowledge. And third is that person that has deep insight into your business or your project. Second is be agile and lean. And that's really just working in being transparent, having the ability to fail fast, working in small Scrum teams, working on small sprint kind of 2 to 4 week project timelines. At Nokia, we had a stand-up every morning as we started, where everyone got 2 to 3 minutes to say what they accomplished the day before. Because it is a huge, project, but if you break it down into bite-sized pieces with epics that kind of lay out what this next sprint is going to do and really make it bite-sizable for your team, it becomes a lot less intimidating. And then Amy touched on DevOps and then data governance. And one thing I want to say about data governance is it is inside out. You want, because you're now collecting data at full fidelity versus just pulling the data that you need to answer a particular business user's question, you have a lot more agility at the beginning of the process. And you have to have that delineation between development and production and layer on the governance as you move towards production. And again, this is something we come in and we talk to companies and organizations at all stages. So when they're just starting out, we give them the high level. A year into it, after they've kind of hurt their bum, fallen down a few times, we kind of go through it and we peel back the layers of the onion. We're happy to do that with any of you. So one of the first questions we get a lot is, what do we do in that first 100 days of any kind of project? What are the first 3 steps we should take? So one is start the conversation about data. So catalog all the available data sets and where they currently live. So if you're looking at the opioid epidemic, what are those available data sets that would really help you better understand that, whether it be EMT logs, pharmaceutical purchase orders, doctor scripts, and where do those live? Who owns that in your community? And what are the properties of that data? Next, brainstorm the actual use cases. What will you try to learn? What are those questions you're going to ask the data sets? And align it to your strategic initiative. So whether that's creating an overall precision health plan for the future. So how will you maybe, you want to use this data, keep using it for different, keep iterating on top of it. And then prioritize your work. Use epics, use some of those kind of agile framework to really help you prioritize where the data is, who owns it, is it available today to you, or do you have to purchase it? Do you need budget? Is it clean? Prioritize the work on what's currently available to you today. And that's all I have, Sean. So thank you.